stable in housing. So the City of Eureka and the Eureka Police Department wanted to increase their capacity to manage homelessness by helping folks with mental illness. In 2011, they hired a homeless liaison, Pamela Millsap, who came to the city from the county where she'd worked for over 20 years at our mental health department with severely mentally ill homeless folks. Prior to that, she'd worked in a locked inpatient psychiatric facility, so she came with a wealth of knowledge, and she still works side by side with our officers at EPD, helping them link homeless people with needed services and housing. The city and county also looked at repurposing the Multiple Assistance Center, or the MAC, which was a transitional housing program that was previously used for families who were recipients of our Welfare to Work program. What we found is that those families were staying in the program for sometimes years, and our community was seeing an increase in single homeless adults. And we saw a need to repurpose the MAC to serve those single homeless adults, which we did. And they did accept people with severe mental illness. However, their ability to manage the behaviors that came with that population wasn't up to par. And so a lot of our severely mentally ill people were exited from the program to the streets. And other folks that were in the program stayed longer than we had expected. That being said, from July of 2015 to June of 2017, we served 292 unique residents. 90 of them entered into or exited permanent housing, exited to permanent housing. The folks that stayed in the program too long created a bottleneck for us to be able to get new people in a timely manner. And that was one of the biggest challenges I think the MISS team in particular we had. It was when we had somebody who was ready and wanted to enter, we were told, well, we're full, we have to wait until there's a bed available. In January of 2015, the City of Eureka and the County of Humboldt launched a co-responder program, MIST, Mobile Intervention and Services Team. They partnered a licensed mental health clinician with an EPD officer, and we partnered together to identify and target severely mentally ill, chronically homeless people who were having frequent contacts with law enforcement. Initially, MIST started with one clinician, one case manager, and one officer, and we now have more than 10 staff members. The initial goals of MIST were to increase outreach assessment and treatment to those with severe mental illness that were having frequent contacts with law enforcement, while also decreasing the number of those encounters with law enforcement, emergency services, psychiatric hospitalizations and civil commitments, as well as arrests and homelessness. We created a prioritization tool to help us identify who those people were. We tracked the contacts that folks were having with law enforcement, emergency room visits, and our psychiatric hospital. And then we ranked folks and created what we call our top 10 list of the people that were the highest users of all emergency services in our area. Here's an example of one of our top 10 clients. He was a well-recognized 50-year-old man with severe mental illness who was homeless in the City of Eureka. He was very visible because he's a large guy. He had a large shopping cart that was overflowing with belongings, and he tended to set up camp outside of prominent locations, like the Eureka Police Department, or our County Department of Health and Human Services administration offices, where our DHHS director and our city council members, our county board of supervisors, our business owners, our community members would see him doing the things that we do inside of the privacy of our own homes, such as washing his hair. Again, big guy. He'd be washing his body, brushing his teeth. He used mouthwash to clean his body, so he would put mouthwash in his mouth and swish it around, and then he'd spit it out on his hands and rub it around, and it was quite the scene. And so, as you can imagine, EPD received many complaints. They received over 185 calls for services from June 2013 to September 2015. When MIST was first started, EPD officers and Pamela Millsap had already created a relationship with him. So they were able to leverage their relationship to pass some of that over to me as the mental health clinician. We worked collaboratively and were able to get him into housing in our neighboring town of Arcata in September 2015. He's still there today. Within the first 5 months, calls for services had gone, they had only received 5 calls for services within those first 5 months. He is still there. However, there are still significant challenges on the Department of Health and Human Services side. His mental health symptoms have continued, and although this is a success in that he's still in housing and his overutilization of emergency services has decreased, it has taken tremendous time, energy, and money from county mental health to keep him in housing. And so I just want to look at that from that side. It is a success, but there's a lot of investment that had come from mental health to keep him in housing. Services fairs were started in April of 2015 by Pamela Millsap at the Eureka Police Department. They were first started monthly and then moved to weekly to target the homeless encampment at Devil's Playground. We were able to pull together several service providers, including substance abuse services, domestic violence service providers, veterans services, homeless shelters, all the county services, including mental health, public health, social services, and medical providers. In the months leading up to the vacation of Devil's Playground, the MIST staff were out there daily in addition to the services fairs. So the services fairs would be offered with all the service providers in a one-stop shop, but then we were also out there every day talking individually to folks in their camps. Without further ado, I'll pass it off to Captain Steve.